With cardiology, you have tangible wins. So someone comes in, they're having a heart attack, you restore blood flow, you have a tangible win when that patient walks out of the hospital, and I appreciate that. I would say that my specialty is focused on general and interventional cardiology. With general cardiovascular disease management, I focus on heart rhythm disorders such as atrial fibrillation. These are the electrical abnormalities of the heart. I also focus on heart failure and valvular heart disease, as well as preventative cardiology, which is identifying patients who are at risk of developing cardiovascular illness and targeting them before disease develops. I'm very interested in interventional cardiology. This is the subspecialty of cardiology that focuses on treating cardiovascular illness using minimally invasive approaches. Some of the ways that we could treat heart disease now includes accessing the heart via the radial artery here in the wrist or arteries in the groin, and we have alternate accesses depending on the procedure. But it saves the patient. We don't have to do any surgery, any thoracotomies, or any open surgery in order to treat these diseases. And as technology develops, we're finding that we're able to treat more and more complex disease using these approaches, which is helpful for the patient. I'm very easy to communicate with. I think maybe it comes from my Caribbean background, but I have a somewhat laid-back way of communicating. But at the other end of the spectrum, I'm very, very committed to, certain, I want to say, old-fashioned qualities, which are hard work, above everything else. I certainly value what I do, and I have utmost respect for the time for my patients, and I would go above and beyond what needs to be done to make sure that my patients are taken care of. One of the things that I enjoy most about my practice is the patient relationships that we create. I think that as complex as cardiovascular disease management has become, it's one of those specialties where the patient sits at the forefront in terms of the management. At the end of the day, our focus when we're managing cardiovascular disease is in improving the length of life and the quality of life